Good morning. My name is Nicole Beseda, and I will be conducting your interview today. The first question that I have for you is, tell me about a time in clinicals at FTCC in which you delivered high quality, patient-centered care to individuals, families, groups, and communities in varied settings.
So when I was completing clinicals at FTCC as a student nurse on one VPS at Cape Fear Valley Hospital, I delivered high quality patient-centered care to one of my patients suffering from congenital heart failure. He was admitted to the hospital for severe scrotal edema, and he was prescribed Lasix, which is a loop diuretic that is given to help the body expel excess fluid. My patient didn't understand what he was being given, why he was being given it, or what it was going to do to his body. So I took it upon myself to explain to him in non-medical terms what the medication was, what it was going to do for him, and then some of the side effects he might see because of it. And as a result, I felt that the patient fully understood the medication he was being given and why.
And why do you feel like this example meets this objective?
I feel like this example meets this objective because one of the most important ways that you can deliver high quality patient-centered care is through educating your patients. As a result, my patient was properly informed on the medication he was taking, what it was going to do for his body, and any potential side effects he may experience from taking that medication.
Tell me how you use something you learned from one of your class assignments to incorporate best practice and professional values and standards into compassionate nursing practice.
So during the fall semester of last year, I was lucky enough to participate in serving lunch to the homeless at the Dream Center run by Manna Church for one of my clinical experiences as a student nurse at FTCC. When completing this assignment, I learned that it's important to refrain from forming judgment when caring for patients, especially in the healthcare field, because no matter someone's social or economic status, you should always provide the same high standard of care, especially because medical issues don't discriminate. And in your career as a nurse, there's a high probability you will care for patients no matter their age, gender, race, economic status, education level, religion, or cultural beliefs. As a result, I was able to put this knowledge to use in my practice as a student nurse during clinicals at Cape Fear Valley Hospital.
Did the outcome of using this new knowledge improve the outcome of the situation you used it for? And why or why not?
So using this knowledge helped me improve my practice as a nurse by refraining from creating personal opinions and judgments when caring for patients. Because as a nurse, you're going to be caring for patients with history of substance abuse, patients with sexually transmitted diseases, and even patients that are homeless as well.
Tell me an example of how you have demonstrated cultural and global congruency in the healthcare environment with diverse populations in promotion of healthy lifestyle and preventative health screenings in clinicals at FTCC.
So during one of my clinical experiences at Cape Fear Valley Hospital as a student nurse, I cared for an African-American male patient that was admitted for a hemorrhagic stroke due to uncontrolled hypertension. Not only did the patient's ethnicity put him at a higher risk for a hemorrhagic stroke, but the patient had hypertension that was uncontrolled, which is also a risk factor for a hemorrhagic stroke. Some other common risks of a hemorrhagic stroke include family history, heart disease, diabetes, obesity. So it's important to ask questions and learn your patient's history so that you as the nurse can properly educate them on ways to prevent this from happening and signs or symptoms they should be watching out for.
How does incorporating this impact how and what you present in patient discharge information and education?
Age and ethnicity matter whenever you're presenting patient discharge information and education because different patient populations are at risk for different illnesses and diseases. And each illness and disease requires different risk factors and things you could be doing to prevent those illnesses and diseases. As a nurse, it's imperative that you provide your patient with specific information pertaining to the illness or disease your patient is experiencing and how their ethnicity, family history, or medical history affect it so that they can incorporate preventative measures into their daily living.
Describe a situation in SIM or clinicals at FTCC where you function as an effective member of the healthcare team, demonstrating excellent interprofessional collaboration.
Okay, so during one of my clinical experiences as a student nurse at FTCC, I was caring for a patient that was bedridden. She had a bowel movement that needed to be cleaned up, but she was unable to turn by herself because she had a surgical incision on her abdomen that was causing her severe pain. This made it very difficult for me to clean the patient on my own because she was unable to turn herself. So I pressed the call bell to ask for some help, and one of my fellow classmates willingly came in to assist me in getting the job done. When my fellow classmate came in to assist, it was helpful, but we were still having a pretty difficult time getting the patient to turn because she was unwilling because of the amount of pain that she was in. So at that point, we called for additional help. One of the CNAs on the floor came into the room and was able to fulfill the extra help that we needed to get the job done. As a result, I felt like we worked really well as a team, and the three of us were able to successfully get the patient clean and comfortable again.
What skills have you learned in classes at FTCC have increased your communication skills in SIM and clinicals at FTCC?
So during my time as a student nurse at FTCC, I've learned to display proper technique of therapeutic communication, to not only responding to the patient's verbal messages, but also responding to their feelings that they're expressing and to nonverbal cues as well. I've also learned that as a nurse, one of your main jobs is to educate your patients and their family members. Effective patient education starts from the time the patients are admitted to the hospital, through their stay and until they are discharged. So as a result of these skills, I feel really confident in my role as a nurse to communicate with my patients and their families.
Describe how you have demonstrated beginning skills in point of care leadership management and care coordination using effective communication skills through either successful completion of class projects or a clinical situation or experience.
So during one of the projects that we completed as student nurses at FTCC, I was teamed up with 4 other individuals to complete an educational skit about nurse burnout. After many failed attempts at trying to communicate with one of the team members in particular, I took it upon myself to step up and try to solve the issue at hand. We tried multiple times to text her, call her, communicate with her after class, and it just wasn't happening. We were having a really hard time getting her to respond. So I ended up contacting the group member individually and informing her that, the needs of our group were not being met by her. I professionally and politely asked her to please start bearing the weight needed by her to be able to complete this group project. Otherwise, I'd really have no other choice than to contact the instructor to inform the instructor of the student's lack of participation. As a result, we were able to overcome our differences, and this group member did step up and give the effort that we needed to be able to complete the project, and we actually ended up receiving an A.
How do you plan to grow and strengthen your leadership skills in your practice as a nurse?
So as a nurse, I plan on strengthening my leadership skills by working on my strengths and weaknesses, being positive and enthusiastic, maintaining my morals and values, developing excellent communication skills, joining professional and community organizations, and honestly, just continuously expanding my knowledge. I feel like these qualities will help shape me into someone that can empower others to work towards accomplishing their goals as well.
Describe how you implement safe and competent care to individuals through both system effectiveness and individual performance in varied healthcare settings.
Um, as a student nurse, I implement safe and competent care by, performing hand hygiene anytime I'm entering a patient's room, leaving a patient's room, or getting ready to perform a task or procedure on the patient. Completing hourly rounding, making sure the bed's in the lowest position, the call bell's in reach. If the patient's a fall risk or their illness or disease warrants it, that the bed alarm is on. Assessing the patient's level of pain, performing physical assessments, performing vital signs, administering prescribed medication at the correct time, making sure that all the patient's needs are met to the best of my ability, honestly. I feel that this promotes the patient's comfort and decreases possible errors that could be made.
Can you tell me about a specific clinical situation in which you identified something unsafe for a patient and what you did about it then and why? Would you change what you did then now? If so, why and what would you do differently?
So a specific situation that, I felt I identified that the patient was unsafe was during one of my clinicals at Kefir Valley Hospital. I was walking down the hallway one day and witnessed a patient that was, not assigned to me, with his gown almost completely off. He was hanging out of his bed, about to fall, and he had a dressing on his hand that was almost completely unwrapped and was exposing a surgical incision underneath. I immediately knew that this situation was unsafe for this patient, so I called for my instructor because she happened to be standing down the hall not too far from me. And together we entered the patient's room to figure out what was going on. So whenever we entered the patient's room, we redressed the patient, got his gown back on him. We got him, back into the bed correctly, so that he wasn't, at risk of falling anymore. We adjusted him to where he was comfortable, but also safe. And like I said, not at risk of falling out of the bed. We wrapped his hand back with his dressing. And while completing those tasks, we assessed the patient's level of alertness. And afterwards, we found the nurse assigned to the patient so that we could inform her of the state that we found him in. Looking back on how I handled the situation, I don't think I would change what I did then. Now, I informed my instructor of what was happening. We went into the patient's room, created a safe and comfortable environment for him, assessed his neurological status, and we also informed the nurse that was assigned to him of what was happening. And as a result, I felt that we were successfully able to maintain the patient's safety.
Thank you for your time. This concludes the interview. I will be reaching out to you. Have a marvelous day.
You as well. Thank you so much, Nicole.